3.
So the first thing we're going to do in our assessment is measure cervical range of motion. So for range of motion assessment, you want to do the active motion first, then the passive. So I'm going to start with cervical flexion. So to line up the goni, you're going to have the patient sit nice and tall, and the fulcrum is going to be at the ear. The stationary arm is going to be perpendicular to the floor, and the moving arm is going to be just below the base of the nostrils. So go ahead and flex your head forward for me, chin to the chest. And he is at about 39, which is good. Normal flexion is around 40. And for extension, the setup is the same. So ear perpendicular to the floor and base of the nostrils. So go ahead and tilt your head backwards for me. And there, he's at about 21, so he's lacking a little bit of extension. The next motion we're going to do is rotation. So for that one, your fulcrum is just at the center of the top of the head. Your stationary arm is parallel to the floor, and sit nice and tall for me. And your moving arm is at the tip of the nose, so go ahead and turn your head towards the right. And he has, go ahead and relax. He has just about 60 degrees, which is around normal, anywhere from 60 to 80. And then same setup, center of the head, tip of the nose, and go ahead and turn. And he has about 72 on that side. And then the last motion is lateral flexion. So your stationary arm is going to be down the thoracic spine. Your fulcrum is C7, and your moving arm is just in line with the middle of the back of the head. And go ahead and tilt your head towards the side like that. Yep. And he has just under 20, which is a little lacking. And then to the other side. And he's right at 20 for that side. So normal lateral side bendings anywhere from 20 to 30. So then you would do a passive assessment. So I would just provide some overpressure. So can I have you take your chin down to your chest? I'm just going to put some overpressure. Let me know if you have any pain. And then back. Any pain. And then bend your head towards this side. Pain. This side. Any pain. Alright. And then rotate. And rotate towards the other side. Alright. And you can also do a measurement in that motion as well, just to assess if you can get any more movement when applying some overpressure. The next thing I'm going to do is I'm going to test the strength in his cervical muscles. Normally, if you suspect that they're having a lot of issues, then you would have them be supine and do it against gravity. But just in a gross assessment, you can do it seated as well. So kind of have you bend your head forward and don't let me push you back. And then bend your head back, don't let me push you forward. Alright, and then bend your head to this side, don't let me push you. And then the other side, don't let me push you. And then push into my hand. And push into my hand here. Perfect. Any pain in any of those motions?
Done.
Alright. So can I have you scoot forward for me, feet flat on the ground. Next thing we're going to do is we're going to assess dermatomes. So dermatomes are just spots on the skin that certain nerve roots provide sensation to. So if you suspect that they might have a neurological problem going on, you would want to assess these dermatomes. So the way I'm going to do it today is I'm just going to go to those specific spots. I'm going to rub on his skin, both sides at the same time, and ask him to tell me if he notices any changes from side to side or if he can't feel it at all. Alright, so C5 is on the lateral side of the arm. Same. Alright, can I have you hold your palms out? C6 is the thumb.
Same.
C7, middle finger.
Same.
C8, pinky.
Same.
And then T1, medial arm right near the elbow. All right, you can relax your arms. All right, L2, anterior thigh. L3, medial thigh. L4, medial lower leg. L5, lateral leg. And S1 is lateral foot. All right, so the next thing I'm going to do is myotomes. So myotomes are kind of like dermatomes, specific nerve roots innervate specific groups of muscles. So I'm going to be asking him to perform movements. I'm going to be making sure he can perform those movements, and then if he can, I'm going to apply a little bit of overpressure just to see how he does with that. So for C5, can I have you bring your arms out to the side? Don't let me push you. And then can I have you make a muscle? C6. And then C7, push against me. And then wrists, can you curl them? Don't let me pull them out. And then out, don't let me push you in. All right. And then can I have you scrunch your fingers up for me? Don't let me pull them out. So that was C8, finger flexion. And then can I have you spread your fingers out? And I'm going to try to push them together, and I want you to resist. So this is T1. All right. And then L2. So for the lower extremity, I'm going to do them one on each side just so he doesn't get off balance. So for L2, can I have you lift your leg up off the ground, hip flexion? Can I have you kick your leg straight out for me? And then bend it just a little. And don't let me push you down. All right. Knee extension. L4 is dorsiflexion. So can I have you pull your toes up? Don't let me push you down. And then L5 is big toe extension. So can I have you pull it up? Perfect. Same thing on this side. Can I have you lift that leg up for me? Can I have you kick that leg straight out? Bend it just a little. All right, don't let me push you down. Knee extension, pull those toes up. And then big toe. And then for S1, can I have you stand up for me? So S1 is for plantar flexion. So an easy way to assess this bilaterally is just to have your patients do heel raises. So can I have you do 15 heel raises for me? $13, $14, $15. Any issue, any pain with that? No. All right, you can have a seat. In the last part of my assessment, I'm going to assess his blood pressure. So when you put the cuff on, you want to make sure you have the right size cuff. You want to put the cuff, you can either do their right or left arm. You want to make sure they're nice and relaxed. You want to place it around the bicep muscle, just a couple inches above the cubital fossa. You want to make sure the ears of your stethoscope are pointing in. Make sure it's on. You want to place the stethoscope over that cubital fossa. And when you inflate the cuff, you're going to inflate it to between 180 and 200. His blood pressure was 122/82, which is about normal. For normal, it's technically considered below 120/80. Anything above that is considered a little bit elevated. When you're taking patient's blood pressure, you want to make sure that they're seated like him, nice and relaxed, feet uncrossed. Don't let them try to talk to you while they're doing, while you're getting your reading. And make sure that they haven't taken any medications before or ask about their medications before. So if you get a different reading than what you're expecting, you can be aware of that.